Awesome, awesome, awesome. Welcome, everyone. We'll get started in 1 minute because it's four. Okay, it just turned 5 minutes past the hour. We intend to keep you here for no longer than an hour, 30 minutes, but ideally within an hour. So welcome, everyone. I am Onyinye Ede Vincent, and I am the convener slash lead and strategic lead for the Adolescent and Youth Engagement Hub. I bring you warm greetings from Calgary, Canada. Well, it's not so warm this morning, but so cool greetings from Calgary, Canada, where it's 7:05 a.m. I know for some of my friends in the US, Eastern time is 9:05. For those in Nigeria, it's 2:05 p.m. And for others, it's somewhere around the clock. So thank you for being here with us. Please type into the chat box where you're tuned in from. I think your country is fine. If you want to tell us your state or your city or your province, please feel free to do so as well. I'm really excited for today's conversation. We're going to be taking a deep dive into the recently launched Lancet Commission on Adolescent Health and Wellbeing. Thank you. Who's that brave soul that just put something in the chat? Jonta, awesome. Jonta, all the way from Ontario, Canada. Oh, well, we're not too far from each other, I think. I see Suzanne Petroni from oh my goodness, Costa Rica. All right. She's also a commissioner from the first time around. Thank you for joining us. We have Ezekiel from Kebbi, Nigeria. I see Venus from Zimbabwe, Queen from Nigeria. Okay, awesome. Great. I mean, I could go on and on saying hi to everyone, but we do have a packed agenda. So let's get into it. For those of you who are just joining, we're recording this conversation. If you know people that intend to join, please get them to join us now because we are not skipping a beat, but they will also have the recording to refer to later on. All right, so let's get started. Let me just quickly make someone else a co-host because I see more people are joining. So if you can help me add them, that would be great. I have some members of my team on here, the AYE Hub, which I will tell you a little bit more about as we get started. So please, my co-host, help me add participants as they join. All right. So welcome to today's edition of our webinar. This is the agenda, just to give you an idea of where we're going. We're going to, of course, I'm opening up with some remarks. I'm going to introduce our guest speakers. Then we'll go into a 25-minute guided conversation. Then we will take some questions and answers, and then wrap up with some call to actions, key takeaways, and then hopefully offer you a chance to network for those of you that can stay a bit longer. So just a little bit about the adolescent. Okay, oh, let's take a poll. Thank God for my slides because I would have forgotten I wanted to do a poll. All right, just a quick poll. If you all can take this quick poll, and I hope everyone can see it, I will give you 2 minutes to take this poll. Let me know if you're having issues seeing the poll. Thanks, Shakira, for dropping the link to the commission. Yes. All right, I see people are taking the poll. Let's do this quickly. We have 24 participants, so I hope we get a full response from all 24 of us, well, except me, so 23. Just give you a minute more. Please take the poll. Don't worry, we're not grading you. There's no, it's not, I guess you get pass or fail, but it's not a graded poll. We just want to see who our audience is, know where you're coming to this conversation from. All right, okay, we're at 10 people. Let's get to 20, at least 20 of us. Keep going, keep going. In the US, we have Jeopardy. So I'm playing the Jeopardy soundtrack in my head. All right, we have 14 out of 23. Can we do better? That's 60% of us. Let's get more, let's get more. All right, I'm going to stop the poll now. We have 16. Does anybody want to get in? Okay, 17. Okay, we're getting there, we're getting there. Give me 20 and then I'll stop. We're at 18 now. Two more, two more. 19. Awesome. One more. Going once, going twice. Who's my lucky number or lucky final one? Oh, we're almost there. 19. Nobody wants to go for 20? Okay. So let me end the poll. We ended at 19 out of 24 respondents. So let me share the results with you. I hope you can see on your screen the the results. So the first question is, how familiar are you with the Second Lancet Commission on Adolescent Health and Wellbeing? 32% of us have read the full report. Well done. That's 6 out of 19. Some have skimmed or read parts of it. We have 21% that have never have heard of it, but haven't read it. And then we have 3 out of 19 of us that this is your first time hearing of it. So welcome, you're in good company. We're going to be learning a lot about the Lancet Commission. The second question is, which area of adolescent well-being do you engage with most in your work or advocacy? Okay, I see majority of us are from the sexual and reproductive health space, followed by mental health. And then we have gender equality. We also have people in policy advocacy. And two of us are just starting out and exploring. That is awesome because at the AYE Hub, we're here to equip those of us that are interested in coming into this space. So you're also in good company. And then the last question, or the third question is, in your opinion, what's the biggest barrier to advancing adolescent health globally? And majority of you say lack of funding. I'm not surprised. And then followed by poor implementation of policies, weak youth engagement, cultural and social norms, limited access to accurate data. Well, that's why we're doing this. We want to make sure that you have the data you need to get that money that we lack. Okay, and the last question, just looking at the spread of people here, most of us fall within the age range of 18 to 24, followed by 25 to 30 years. Okay, great. Awesome. Thank you all for taking this poll. We're also going to have a post-event poll at the end, so hopefully you stay with us till the end. And I hope you found this pre-poll insightful. All right. So a little bit about the Adolescent and Youth Engagement Hub. Just quickly, I said earlier, my name is Onyinye Ede Vincent, and I'm the founder and strategic lead for the Hub. And we're a platform that is dedicated to showcasing thought leadership when it comes to youth engagement. We're also here to educate young professionals on careers in the development space, and we're here to provide technical insights for organizations that want to work better with young people. And most importantly, we want to amplify the expert voices and youth perspectives. We know we have a lot of brilliant people across the world, so we want to bring them a little closer to young people and get the networking going. And then lastly, we are here to advocate for youth-centered policies. Why do we exist? Because the world needs more young people being meaningfully engaged. Our vision is a world where young people are meaningfully engaged, empowered, and supported through responsive health systems and inclusive development programs. On a day-to-day basis, we are dedicated to amplifying expert perspectives, which you're going to hear today. We're also dedicated to equipping young professionals and supporting organizations in designing and implementing youth-friendly programs and policies. All right. So let's get into today's agenda. Meet our speakers. So today we're joined by two brilliant women. I'm just really excited to have both Dr. Shakira and Augustina Mensa-Kwao with us. They will help us unpack the key messages, the opportunities, and the next steps. So for those of you who don't know, last month, the Lancet released the second edition of its Adolescent and Youth Health and Wellbeing Commission. And this is a landmark 78-page document for those of you who have looked at it. It calls for urgent and coordinated action to prioritize the needs and rights of young people around the world. But what exactly does this document mean for young people, and what exactly is in the document? So that's why we have Shakira and Tina to guide us through today. So whether you're an advocate, whether you're a policymaker, whether you're a health professional, or you're just getting started in the development space, this conversation is for you. All right, so let's meet Dr. Shakira. Dr. Shakira is a multi-award winning public health practitioner and a bold activist. Her notable accolades include being named the 2017 Woman of the Year in Health in South Africa. She's also 100 most influential young African, and she has been recognized as a top-rated emerging practitioner by both the National Research Foundation of South Africa and the Public Health Association of South Africa. She is widely recognized for her work on universal health coverage, gender equality, sexual and reproductive health rights, and development. She holds over a decade of experience spanning academia, advocacy, contributing to global health policy, and she has been at the helm of large-scale organizations, such as being on the international board member of AMREF, that's AMREF Health Africa, and she has also been the inaugural youth appointee of the African Union Youth Council. Recently, she's a Lancet Youth Commissioner, and she's a member of the steering group for the Second Lancet Commission on Adolescent Health and Wellbeing. All right, there's so much more to know about Dr. Shakira, but I'll just stop there and get to our second speaker. Our second speaker is Augustina Mensa-Kwao. She is a PhD candidate in the Department of Mental Health at Johns Hopkins Bloomberg School of Public Health. Her dissertation research explores how access to and quality of urban public spaces like green spaces influence youth mental health, both positively and negatively. Tina earned her bachelor's degree in neuroscience and global development studies from the University of Virginia, and then she earned her master's in public health in behavioral sciences and health education from the Rollins School of Public Health at Emory University. She brings expertise working with and on youth advisory boards worldwide, including recently serving as the Youth Commissioner on the Second Lancet Commission on Adolescent Health and Wellbeing. She has a very strong commitment to youth empowerment, and she strives to transform mental health systems to be more inclusive, effective, and responsive. So without further ado, please give us a warm and rousing round of applause to our speakers for today. Welcome, Dr. Shakira and Tina. I hope everybody's hearing me all right. I'm going to stop sharing my screen so that I can see everyone. Awesome. Okay, so let's get right into it. Dr. Shakira and Tina, let's start with this question. What prompted the Second Lancet Commission? How did we get to a second version? Any one of you want to take this?
So I'm happy to kick us off on Yenya, and it's brilliant to check in with many of you, and thank you for joining us from all across the world, and excited to see that there's a mix between those who've read the commission report, those who've skimmed it, and those who I believe are going to read it after this call. So that's exciting and wonderful to be here with Tina, who's brought great energy to the commission as well. Jumping to your question, and I think many of you know this, many of you sitting on the call, like Chandra and others, are adolescent health experts and renowned adolescent health experts, but the evidence is crucial. And what the first Lancet Commission did was bring together the latest evidence, the trends, but also new ways of thinking, and importantly, recommendations. And the first commission in 2016 set the basis and really did a stock take of what's needed across the world. It pushed framing and thinking around adolescence being important in terms of thinking about the life course. So the decisions and the investments that you make in adolescence has the capacity to, sort of influence what we call the triple dividend, or what the first Lancet Commission called as the triple dividend. So investing in adolescence now allows for the adolescence of the future generations and generations to come. And so that sort of framing model of thinking, the importance of the statistics was important in the data. And it's about 5 years later since the last commission, or even longer since the last commission was launched. And obviously, you can't have one static report informing a world that's changing so rapidly. And the world's changed significantly and rapidly. And so that sparked the importance of having a second commission. The second reason I would say is also, and what the second commission shows us, is that we have alarming trends which are emerging and alarming issues which have not been addressed. And so that also sparked the need for new commission to guide policymakers, donors, investors, and even implementers. I'll stop there for now and over to Tina as well.
Thank you so much, Shakira, for covering all of that. You really t hit the head on what sparked this commission. I wanted to also add, in addition to what you mentioned, again, we are having these new issues that have come about: climate change, environmental degradation, the COVID-19 pandemic, the digital transformation our world is going through, as well as all the additional commercial influences that I believe the report really emphasizes. Additionally, what I wanted to highlight about this report, and we'll talk about it a little later, is we're recognizing the importance of bringing and having youth not just at the table, but being deeply involved in the issues that affect them. And so, what this commission did very uniquely is it brought together 10 youth commissioners as co-leads for the work streams on the different areas that we are talking about in the commission. And so, really prioritizing youth voice in both the creation and support of data, as well as thinking through how can we best include young voices, the ones that are even often marginalized, into really shaping research, policy, and advocacy around these issues.
Thank you, Tina. And speaking about the intentionality behind including young voices, I'm curious to know how both of you got involved with the commission. Tina, do you want to get started? Or
Sure. So I kind of fell into the commission. I was applying for an internship, a summer internship with the Exemplars in Global Health program with the Gates Ventures, which is the private office of Bill Gates. And I was working on the adolescent sexual and reproductive health team. And so, as part of this position, I served as a liaison for the Second Commission on Adolescent Health and Wellbeing. And one of my key responsibilities was spearheading a systematic review, which is just a rigorous review of the literature using machine learning to really understand how programs and policies in adolescence, what are their long-term effects for adulthood and potentially intergenerationally. And so there is a section of the report, I can't remember the exact page number, which talks about the findings of this systematic review, which looks at the long-term effects of investments made in adolescence. And we really wanted to make the case for policymakers to invest in young people, not just for today, but to invest in strategies for long-term national returns. And so just looking through this lens of how young people contribute to society as they grow older. And so, what we found specifically in our review were that there were two main areas with strong evidence, and these were around investments in education, particularly for girls, and in social protection, which includes things like conditional cash transfers to really help not just the adolescents, but their family out of poverty. And I can talk more about that if anybody has questions, but really just making the case for why investing in adolescents is important, not just for the adolescent today, but again, as Shakira mentioned, the triple dividend. And so that's kind of how I got initially involved. And then I also co-led a work stream with Dr. Pamela Collins looking at urbanization and youth mental health. And so, as many people probably don't know, but by 2050, 68% of the world is going to be living in urban areas. And urban areas, not just they're places for opportunity, including schools and better jobs, but they're also associated with negative mental health risk factors like increased stressors to violence, to potential increases in depression, loneliness, things like that. And so we really take a deep dive into thinking about how cities can developmentally respond to the unique needs of young people who are going to be more and more living in cities. And I can talk more about that at a later time, but I'll stop there.
Yeah, thanks so much, Tina. Shakira, over to you. How did you get involved?
So it's a good story to tell, and it's an interesting story to tell, and maybe one day I'll write books about it. But for those of me who know me from the continent and who I've had the pleasure of working with on the continent as well, and by this I mean Africa, many of us have fought very hard over the years for meaningful adolescent and youth engagement. And so I like to think of myself as I wouldn't say troublemaker, but a constructive troublemaker. And back in my very young days, there's videos of me standing outside the United Nations complaining about having 2 minutes in the assembly hall. I've also written, on behalf of youth on the continent to the chairperson of the African Union around meaningful youth engagement for my role in the African Union, and even written to the president of South Africa on corruption and the importance of building the country. And so, really, like I said, it's an interesting story to tell, but an exciting one as well. Some of these experiences and also activism and advocacy have led to me being recognized as someone who's able to think through and craft meaningful adolescent and youth engagement. And 4 years ago, it was really, really great. It's the first time I had met the author of the first Lancet Commission, Professor George Patton. He's late now, but the first Lancet Commission had 6 youth commissioners work only on the recommendations of the commission, as far as I understand. Of course, they were probably involved in different ways. The second Lancet Commission, which we'll speak about a little bit more, led to more robust ways of engaging youth and adolescents within the commission. But George Patton and Professor Susan Sawyer had sat down with 3 or 4 of us, initially sort of recruited to be in this Lancet Commission, and said to us, we want to make sure that adolescents and youth are front and center of this commission. And we're asking you now, before we've even started this commission, how do we do this? What's your ideas? What don't you want to see? What would you like to see? What would you like us to prioritize? And for me, Onyenya, that was just so refreshing. It was such a good sort of platform to start on, or sort of basis to start on, because you hardly get into a space where young people are involved at the very inception of a project, and also in the designing and the thinking. And so I want to give full credit to Professor George Patton and Professor Susan Sawyer, who sat down with the 4 initial commissioners who were recruited for the commission. And I also want to pay tribute, because for those of you who know and those who don't know, Professor George Patton has passed on, but essentially his contribution lives on through many of us in this commission.
Awesome, awesome. Thank you so much, Shakira. And I'm glad I asked that question. I asked it because we do have a number of young people on here, and a lot of times young people want to know, how do I get connected? How do I get myself on a global scale? And I love your responses. Tina talked about applying for an internship, and see how an internship with the exemplars now ended her up, or took her to a global platform where she gets to contribute to the Lancet Commission. And then you, Shakira, you highlighted your advocacy and activism. Many times we do things and we think people are not watching. I know, well, in this time and age, we have phones that are eager to record every single minute of our lives. But even the ones that are not being recorded, you never know, somebody is taking notes. And Shakira, I do believe you said it's as a result of some of this work you've done that you were approached to be part of this commission. And I'm sure that's also why you got to be the first youth, was it youth envoy for the African Union? So I'm just putting that out to say, for every young person that desires to be in a space where Shakira and Tina are right now, just know that you can, just from volunteering, you never know what opportunities could open up. And then also, if you're passionate about a cause, she talked about being angry for just being given 2 minutes to speak at the UN. So whatever makes you angry, write about it, speak about it, and yeah, you get to contribute to these local, global outcomes. All right, great. Thank you so much for sharing. So let's get into this commission because that's really why we're here. I don't know which of you wants to take a stab at just walking us through what are all of the different topic areas that are highlighted in this second commission and how is it different? Maybe some of the topics are new or were modified or updated with in terms of the data. So can you just talk to us about if you were to give a Cliff Notes version of the Second Lancet Commission, what would you say? I don't know who wants to go first, but feel free.
Okay, so I'll kick us off. I don't like to take the space too much, so I was pausing to see that if Tina wants to go first. So Tina, if you want to go first, you may. Otherwise, I'll jump ahead.
You can go ahead and I'll add on.
Sounds good. And Anya, when I have a chance, I'll pop in the chat box. We actually worked, and this forms part of our discussion as well around how did adolescents and youth shape the commission. And actually, we had what we called youth solution labs, and these youth solution labs were held in partnership with UNICEF and an entity known as GovLabs. And together with the Lancet Commission, we had engaged close to 200 adolescents and youth across the world in 35, 36 countries, if I'm not mistaken. And we had asked these young people, what are the priority issues that we need to look at as a commission? What matters to you in your communities, in your country, in your region, around the globe? And then also, what's the solutions that you would propose? So actually, what's so phenomenal about this report, and I'm excited about it, not just because I'm part of it, is that youth themselves have contributed to the recommendations and the priorities of this report. And so this commission really took a holistic lens, not only looking at adolescent health per se, but thinking about what's the different elements of adolescent health. Many of us work in SRHR, but of course, there's mental health, which Tina and others work on, planetary health, also thinking about the commercial determinants of health so that one, a holistic and comprehensive approach of adolescent health, but then also thinking about it, how do we really, really start to think about the trends, the new ways of thinking, also around education, employment being highly critical for young people, and thinking about those broader determinants as well. So in a nutshell, I'm not going to share go into the findings yet, but in a nutshell, those for me, or that for me is really the approach that the commission took, which I think is really, really powerful. And thinking of an adolescent is important, not just in terms of their health, but the broader society and system that they're part of.
That's great. Yeah, you covered most of it. I just wanted to highlight that another unique thing that I think the commission did was really model what some of these issues would look like if they're not taken into consideration now. So, for instance, we know that there's a global youth mental health crisis. And one of the things that our report talks about is how mental health and suicide are expected to account for 42 million years of lost health life by 2030. And there's been a sharp decline in recent years, particularly because of COVID-19. So, yeah, there are a lot of areas, and we also talk about like obesity trends and what that's going to look like in the future, as well as other topical areas. And so I think th those are also new ways of thinking about how these issues, if they're not taken care of, invested now, how they're going to affect our future.
Awesome. Thank you both. So some of the topics that I see are in the document are like mental health, as Tina has emphasized, sexual and reproductive health. I think there's also mention of climate change. I want us to drop like specifically what are the subject areas for those that haven't had a chance to look at the document to know what are the main issues that we are seeing are impacting young people. And I love the diagram that is in the document. I think it's like figure 7 that shows the priority needs amongst adolescents and young people. It even includes things like homelessness. I mean, the issues there's a lot of issues, but it just highlights how interconnected these issues are and the political and the social elements that shape these issues for young people. So I definitely encourage everyone, if you haven't had a chance to read the document. It is lengthy, but you can just take your time to review it. And for everyone, please, at any point, if you have any questions, please feel free to put it in the chat. We did receive some questions ahead of today's conversation. So once we get to the Q&A, I will start off with those. But if you do have pressing questions, you might not get a chance in the near future to speak to Shakira or Tina, so you might want to get it out like today. So make sure you're ready with your questions. Okay, Tina and Shakira, what are the next steps for implementation and advocacy? And let me just put the context here. When I saw the launch, I happened to participate online, and thank you both so much for your leadership in the launch of this document. The first question on my mind was, okay, great. We have another document on the shelf. What does this mean for young people? What does it mean for people that are serving young people? How can these documents be a resource for evidence-based advocacy? I'm a Nigerian American, so if I want to go to my Minister of Health in Nigeria or in my state or my province, how can I use this document to advocate for the needs of young people? So I'm curious what you all as youth commissioners are thinking of in regards to the next steps. And I'm hoping you did think about how do you implement this document? Because all of us know that it's not just about publishing a document, but it's about, okay, what next? So if you can touch on what are the implementation steps moving forward?
I can start here with a few of the ideas that I've been thinking about and how we can translate a lot of the evidence in the report into practice. And so yes, the report is lengthy, but there's so much information there that can be used and leveraged for both policy advocacy, for youth engagement in research practice and advocacy. So like for instance, I would say one of the key things that came out of this report that youth commissioners help lead, particularly our youth commissioner Jason, was the meaningful youth engagement checklist for how to actually include young people in research, practice, and advocacy in a way where there's not just going to be tokenized, but we're tracking how we're actually, you know, incorporating youth voice into these solutions. So that's a checklist that, you know, anyone who is doing research with young people or young people who want to do research with researchers or advocate for themselves, they can use that checklist. And there's also a separate paper that I'll throw in the chat that talks about how to use the checklist and things like that. Because we know that oftentimes young people are tokenized in these experiences, and they're not really their full voice isn't heard. They're not included from the very beginning. There are positive examples of how meaningful youth engagement has been done really well. And one of the experiences that I talked about was during the launch and in Colombia, in a small rural area. These young people, they basically there's a law in the country where young people have to be included in political work. And so they have a whole youth council in the mayor's office. And they have figured out ways to really make sure that their priorities are being heard. And that includes finding common ground with these mayors. You know, a lot of times there are priorities already set. So looking and seeing how can we align our priorities with what's already there, taking the time to build relationships with leaders, whether that's leaders in your local government or if you have access to other leaders in the community who might be taking an interest in areas that affect you. It's important to build those relationships because I think trust is the most important thing to really, you know, having people listen to you and see that, okay, I'm bringing knowledge and I'm bringing my own experience. One of the things that I think we often forget is that young people are experts in their experience. They know what's happening to them. And as a result, you can use your own experience to further the issues that affect you. And I would also say that it's important to use this document to elevate accountability, not just in like policy, but in research. Uh, we can really use this document to help strengthen like monitoring of certain indicators that we've highlighted in the report and implement these indicators and make sure we're holding our governments accountable when it comes to different health topics. I'm gonna stop there. I'm curious to hear what Shakira has to say.
Yeah, thanks for laying the basis, Tina, and Anya, thanks for the question as well. And thinking about it, I mean, and again, thinking out loud here, right? But what are the main priority issues which are coming out of the report? And one of our taglines is the time to act is now. And it talks to what's the cost of inaction if we don't take action by 2030, but also by 2100. So the main issues we want to sort of think about and address are there. They're on paper, and they, for example, speak to the fact that there's an investment gap. So to reiterate the main findings of the commission, there's an investment gap. We have a quarter of the world's populations, 2 billion adolescents, 9.1% of the burden of disease, but only getting close to 2% of development financing. So there's a mismatch between 9%, 2% in the global population. There's also issues like the fact that adolescents and youth in the past 3 decades are growing up in increasing or doubling amount of wars and conflicts. 18% of the world's adolescents are living in war and conflict zones. Looking at what's happening in the world, the falling away of global human rights, of a value on human life, of the killing of children and adolescents, I think this is a significant finding that's really important. The gender divide worries me and keeps me up at night. And the finding for Africa specifically, and sorry to everyone about speaking about Africa so much, but nonetheless, the finding of if we don't take the investments we need now, today, by 2030, we're looking at 20% more adolescent girls and young women not being in education, employment, and training. And for me, we already know that across the African continent, South Africa, for example, rates of unemployment, youth unemployment about 60%. Egypt, for example, youth unemployment about 60%. So these are the real tangible issues. And I wanted to highlight them because I think starting there is what happens next. So one, we've got the priority issues down on paper. Second, it's now about reaching the range of stakeholders. Tina spoke a lot about the youth, and I am a fan, and I believe that the youth will definitely be able to shift boundaries and take the issues forward. But also, it's going to be important for us to engage with regional bodies, whether it's the African Union, whether it's the African Development Bank, for example, whether it's Latin American and Caribbean countries. So, thinking about the regional bodies is going to be critical. Also thinking about national level governments, thinking about the changing political dynamics, the G7, the BRICS, for example. So for me, reaching the policy makers is absolutely critical. And then in this donor landscape, thinking about how do we take these priority issues to the donors to think about as well? And then, of course, civil society. And actually, another interesting story to tell is one of my first jobs in sexual and reproductive health and rights in civil society. I had started in 2017 at what we know as the SRHR Africa Trust or Southern Africa AIDS Trust. And my executive director at that point had come into a room and said, Shakira, you're going to be leading programming on adolescents across Africa. I want you to read this Lancet report. And so I read the 2016 report, and I subsequently used it in guiding programming, in guiding our advocacy campaigns. So I think, as Tina said, reaching civil society like yourselves, Onyenya, and the Adolescent and Youth Engagement Hub is so critical because it's what we find, and this is my own opinion, it's not the Lancet's, of course, but what we find is that civil society really, really pushes accountability. So together with young people and CSOs, I think all of this is exciting, and some CSOs or some international NGOs are also sitting on this very webinar, and they've already reached out to say, how can we disseminate further? How can we take the agenda further? And so for me, that's exciting. And I would end up saying that it's not just a one-way stream where we push dissemination and advocacy, but we hope that all of you as champions will join us, and all of you will also partner with us to take forward the life of the commission.
I love
Awesome.
that.
Oh,
I love that. Because she made some really strong points there, and I just wanted to reiterate again that there's so much information, data, evidence, recommendations in this report, and everyone here together, we must be able to use the report to advocate for these priorities for young people, both on the local, regional and international levels, right? And so present the findings to to your governments, whether that's local, regional, national, to donor institutions, and really push for centering young people and um, your expertise in these areas. And this could look like, you know, making youth-friendly summaries of the report and disseminating it into your networks. How can you push content on your social media? We know that, young people have different ways in which they receive their information. And so you can help us, partner with us to figure out how we can get this report, this really important report out. Again, using the report findings to focus on community dialogues, forums, online campaigns, things like this, where we're having to talk about the report, talk about our findings, and expand our reach. I really do think it's a holistic effort of everyone, right? And you can also come into this with your own lived experiences, as I mentioned before, because we have so much to say. Like, I'm passionate about mental health because of my lived experience with it, right? And it's often those who have lived experiences that can really um, communicate why these issues are important to us.
Exactly. It's really everyone who has the lived experience that can communicate. Oh my goodness. You're saying so much and we have limited time, but I'm sure you all consider us as a partner. The AYE Hub is a partner. We're here to help you get this document across the globe. And I recognize that this 1 hour is not going to do justice. And I think one of the next steps I want to suggest to you all to pass on to the larger group is how can we form, I don't know if we'll call them technical groups, communities of practice that would delve into the findings of this report and then localize it. Tina, you were speaking my language when you talked about youth-friendly versions. One of the things I thought of when I saw the 78-page document, I'm like, this has to be narrowed down into like 5 pages for young people because of our attention span. But even adults, many adults will not read the entire document, and especially our politicians. So how do we break this information down to digestible versions? And it also makes me think of one of the volunteers of with the AYE Hub mentioned to me that she would love to conduct her own assessment in her country, using the findings of this report to just triangulate some of the things that she thinks are pressing issues in her country. And I'm sure maybe if she's on, she can maybe share more about that idea. But I think, yes, that's like one example of a way that young people can engage with this resource. I know we're running out of time. The last question I'll have for you both is to share with us, what are some of the lessons you learned in this process? In the process of being part of the commission. And in line with your lesson, what advice would you give to the young people, but also the professionals that are serving young people who are listening today?
Okay, I'll kick us off on this one. And I think there's so many on Yenya and Tina and others. And so um, there's, of course, very strong mechanisms and approaches that we used for youth engagement. So having youth as colleagues, as Tina mentioned, having the youth solution labs, but also having youth reviewers. And I believe Jonta is also on this call. So having 6 youth reviewers at the very end stage as well to sort of make sure that we're still on track when it comes to youth engagement. Have we addressed all the issues? Do we have the perspectives has been really important and really, really exciting. And so I think that the methods we've used in the commission are quite exciting. I would also say, reflecting on the fact that we have 44 commissioners, and it's not just traditional researchers. It's really it's academics, it's policymakers, it's activists. It's brought together such a diverse range of stakeholders, and I think that's what makes the commission so exciting. Is that it's not a traditional, academic exercise. It's also got people who practically use the information, who shape it. And then I'd also say that, some of my other learnings is that it's a lot of work. So don't underestimate it. It took us at least 4.5 years to write it. That's as long and even longer than a PhD sometimes. So the immense amount of work, the robust discussions, the agreements, no, this is not right, add this. But I think having that, being engaged in the commission for me has been exciting. It's having that open space where we're able to really shape things. And Tina, I'm thinking about our meeting in Kenya, where I was so impressed because we had, meetings throughout the commission, but one of them in Kenya was around just having youth commissioners take the entire table, give their perspectives, give their ideas, and the others were just listening. And the same for the Youth Solutions Lab. So yeah, many things and many things to learn from there. But I'd also say that, sometimes there's a lot of expectations also because it is a research commission. And again, that's why I'd emphasize and say that partnerships are important in taking the work forward. I don't think it can only be our responsibility as commissioners. Over for now, back to you, Tina.
That's awesome. You definitely have me reminiscing on our times in Kenya. And yeah, this has been such a unique opportunity to be part of a commission like this, where I genuinely feel like our voices were heard. We were given the platforms to speak, to craft our own ideas, and they were actually included in the commission to drive this forward. I think this is a model that other organizations, commissions should adopt because it's so important, again, to ensure that we are reflected in the report and that we can also participate and make sure that the findings are disseminated in ways that are meaningful and also accessible to communities that we want to work with, and we want to make sure that at the end of the day we are moving the needle on these issues. I think one of the things that I've learned, and I think we could have done a better job with the commission on, is the idea that oftentimes marginalized youth are hard to reach. As Shakira mentioned, nearing the end of the commission, we brought in youth reviewers, and they were from very different, right? So we really tried to bring in unique voices that might not be represented. I know one of the youth reviewers, she's a disability rights advocate, and when she came into the meeting, she was very passionate about how can we include more information around disability justice for young people. And I think that's, if she wasn't in the room, that angle might ha not have been included. Um, when we think about marginalized youth, I think from the perspective of adults, I think one of the things they have to realize is that many marginalized youth are already participating, and it's often at their own personal risk. And if governments and organizations really want to be accessible, they need to find better ways of communicating, showing up locally, creating real and resource channels for young people to engage. And when I'm talking about resource channels, if you want to reach rural youth, you need to make sure you are creating avenues that youth from rural communities can engage. Is that giving more mobile time money? Is that transportation? You need to invest in having young people at the table, right? And the institutions really need to stop expecting young people to come knocking and start building bridges physically, digitally, relationally with young people, especially marginalized youth, and stop assuming that they're not interested because they are. I'm sure every young person on this call is very interested in the issues that affect them, and they really want to be civically involved. I think there's also a capacity building aspect. As Shakira mentioned, this was really time consuming and hard. And, I learned a lot in the process. I built new skills. I learned machine learning. Like, there's capacity building that has to happen for young people when it comes to, things they're not familiar with. So helping young people get those skills, whether that's through like peer-to-peer learning. I've learned so much from my other youth commissioners in how to think and frame different things. And I think there's a lot of benefit in that too. And so, yeah. there's so much to be talked about, so much to be learned. I'm gonna stop there, but I do think institutions have to take ownership of like also, involving young people and being really thoughtful about that.
Yeah. Beautiful, beautiful. I know that Shakira has to leave us like at the hour, and I'm sure Tina, you also are a very busy PhD student. Um, so I will give both of you a chance for like any final word, but I do see some activity in the chat. I see some networking happening. People are dropping their phone numbers, their LinkedIn, maybe their account details. I'm just kidding. But Monica also talked about how FP 2030, shout out to FP 2030 in the house, how FP 2030 can support this initiative. I think you both have given like some really great suggestions. One is about like investing in more youth-friendly ways of disseminating this report. I love what you said, Tina, about you have to invest in having young people at the table. Many times adults feel like it's a lot of work to get young people, but I mean, young people are just starting out. They don't have the access to the resources. So yes, you do have to put in some work to get them to be effective at that table, not just getting them there as well. Okay, so last words from Shakira. We can start with you, and because I know you need to drop off, and please share your contact details because people might want to follow up. I did want to emphasize what Shakira and Tina said. It's a lot of work. A lot of times I meet young people who are like, oh, Nini, you're doing such great work. I want to do this. I want to do that. But then when you invite them to a meeting or ask them, okay, read this report, and you ask, okay, how far? They're like, no, I haven't had a chance to do it. But I'm like, you want to become the next Shakira or Tina, you have to put in the time, the efforts, you have to read. So yes, for every young person listening to us, know that this doesn't just happen in a day. Shakira said it took like 4.5 hours to come up with this. I mean, four not hours, 4.5 years to come up with this document. Okay, so over to you, Shakira, with your final words.
No, just thanks again for hosting us. And I didn't want to name FP 2030, but essentially thanks to great supporters like Monica, we've been approached to, partner. And so, Monica, thank you for that. And I also wanted to, my lasting sort of remarks are based on what Monica's put in the chat box. And sure, Tina and I are sitting here, and many of the youth commissioners, I hope, and, have had a wonderful experience being part of the commission. But unfortunately, these sorts of spaces do not exist completely. Even when they do exist, youth, for example, youth work is not professionalized. Our youth work in the commission was actually professionalized. Thanks to Tina, for example, we had resources which were raised for the youth commissioners to participate in this commission, as well as the youth reviewers at the end. And so while it sounds all good and well to say invest in young people, have young people at the table, it's easier said than done. And even when it is done, it's not done correctly. And even when young people do make it to spaces, like many of the spaces I've been in my young days, I'm no longer young, but in my young days, I would say it's really difficult to remain there as well. So having the enabling systems to one, support you into a system, keep you in the system, and also enable you to contribute and lead to the system is important. So, yes, we have positive stories to share, but unfortunately it's not the reality on the ground. It's one example, I think, of wonderful and phenomenal youth engagement throughout the commission, but it's got to be replicated and it's got to be scaled up.
Love that. Yes, it needs to be replicated and scaled up. I echo those sentiments. I would say thank you for hosting us. Thank you for starting this conversation and increasing the reach of this report. I do hope we can continue the conversation as as I mentioned, we're all in this together. This is our now, our future, our children's future. I would say share your stories. Everyone has a story to tell, and whether that's infographic or video, your social media, translate key messages from this report into a format that resonates with your peers, right? We really want to be able to continue not just the discussion and raising of these issues, but thinking thoughtfully about how we can take action. One of the things the report really hones on in is that it's not just going to take these silos, it's going to take multi-sectoral action. Mental health is integrated with climate change, is integrated with violence. all these issues are very much connected. And so we have to have multiple disciplines coming together, not just our traditional ones. And I think the report and the commissioners on this report really do show that. So yeah, share your messages and spread this information and partner with us to see how we can actually take action from this.
Awesome, awesome, awesome. Thank you so much, Tina and Shakira. I know Shakira just dropped off. And I'm sure Tina will also need to drop off soon, but I do want us to do our post-event poll. So I'm going to share the poll now. And while we're doing that, if anyone has a pressing question you want to ask, please feel free to unmute yourself now. This is your chance. Don't be shy and type it in the chat. Just unmute yourself while I launch this poll for all of us to take. All right, can everybody see the post-event poll? If you don't mind, please take it. It's just 3 questions. The first question is, after this session, how confident do you feel in using the Lancet Commission to inform your work or advocacy? The second question is, what will be your next step after today's conversation? The third question is, would you be interested in joining a follow-up session or community of practice around youth health and engagement? Okay, we have 10 out of 25 that have responded. Give you 1 more minute for others to catch up. So while we're completing the poll, does anybody have a pressing question? If not, let me try to read a question that came in from earlier. So for Tina, given the recent changes in global health funding, what do you envision the future of adolescent health will look like globally? I know that's a big question.
That is a big question for sure. Oof. I I think right now what we're going through is temporary. And I like to just kind of think about it as temporary because it is. And there are so many people and organizations that understand why it's important to continue investing in health disparities. There is a business case to be made about the offset of prevention and intervention early on compared to if you don't, and what's going to happen and how that can overload health systems altogether. And so there are different organizations like Robert Wood Johnson Foundation. There's other that I know of in the US, and I'm not sure, but there might be other organizations that are still funding a lot of this work in other countries. But what I do think is that it's probably going to get a worse before it gets better, but it is going to get better.
It is gonna get better. Nice one, nice one. Okay, Ramon, I see we have a hand up. Ramon Olanrewaju, do you want to share? Just a quick second. Let me quickly read out the results of the poll. So 55% of us feel very confident in our ability to use the Lancet Commission to inform the work we do, which is great. What will be your next step? 45% of people say you will read or revisit the Lancet Commission. 30% say you will use the insights to inform a project or advocacy effort. That's great. Lastly, would you be interested in joining a follow-up session? Oh, 75% say yes, count me in. And then one person says, no, not at this time. It's okay. No worries. But yeah, so for the 15 out of 20 of you that said yes, we will try to link up with you because we'll definitely have follow-up sessions following today's event. Okay, Olarewaju, the floor is yours.
Very much. Hope you can hear me.
Yes, we
Can
can.
you hear me?
Yes.
So my question is your last statement. So how do you get to follow up after this today's sections? So because I know that I got my details on the chat box. So I don't know if there's anybody has been getting that so that we can be expecting maybe further communications from you. Thank you.
Yes, and thank you so much for wanting to stay in touch with us. Since you registered for this event, we have your details. And thank you for sharing it in the chat. We are saving the chat. So we will definitely be in touch for the next steps, because I know this is just the beginning of this conversation. All right. Okay, Chinwe. And okay, so Chinwe, go ahead with your question, and then we will wrap up and then open up for networking. Chinwe, go ahead.
Okay, good afternoon, everyone. It was a great privilege to be part of this meeting today. So my question is, with the rising socioeconomic development now in the society, both globally and locally, what is the direction towards neurodivergence inclusion, like towards adolescents that have learning disabilities or are on the spectrum per se. So like what's the inclusion towards them? What's the current happenings around their own adolescent world? Because it's quite different from like us that are like neurotypical and stuff like that.
Yeah, Tina, I don't know if you have any perspective on how young people with different abilities were engaged, and what the possibilities are for future engagement will be. I think that's what Chinwe's question is speaking to. So if you can touch on it a bit.
Yeah, I think you raise a really important point, and one that I've definitely thought about a little bit. Um, as I mentioned before, oftentimes marginalized youth are just deemed as hard to reach, and institutions just don't reach them. And I think there needs to be more uh, of a partnership to be able to include neurodivergent young people in these conversations. um, I'm very curious to hear if your thoughts on ways in which this population may have been engaged in programs and efforts that you've been a part of. But I think we definitely need to be thinking more about how can we engage these young people that are typically not engaged. Like, you mentioned neurodivergent, disabled, rural communities of young people, different communities that might be affected differently and their needs are different. So I think that's definitely an ongoing conversation, and we need to together thoughtfully think about how to do this.
Great. Thank you so much, Tina. And I'm sure we'll continue to have conversations around this, especially for those of us that are really passionate about engaging people that are neurodivergent and other areas of interest for all of us. So thank you all so much for joining us today. I really hope you found this session helpful, insightful, and valuable for your time. I know I've seen a lot of good feedback in the chat, so thank you. I want to give you a chance to to connect with the AYE Hub. We are on Instagram, we're on LinkedIn, we're also on Facebook and YouTube. But since you all registered, we will be sharing this information via follow-up message to you. So thank you for joining us today, and I hope you have a great rest of your week. If you would like to partner with us or volunteer with us, we will also share more information about this. So thank you, and feel free to stay on a bit longer if you want to like connect with others. I'm going to keep this on for probably about 10 more minutes, but we're officially done, and we really appreciate everyone for joining us today. And please share the word. We're going to share the recording with you. Please help us share it across your networks. All right. Have a great day, everyone. Happy Friday and happy weekend. Bye. Thank you so much to our speakers, Tina and Shakira. We really appreciate your time.